unless we love and unless we are loved, we all are alone and we all are lonely. Emotional intimacy and physical intimacy are the true roots of love. Around the world, people love. They sing for love, they dance for love, they write poems, there are legions, there are plays, there are movies. They build monuments, they die for love, they kill for love. In fact, we all sitting here are all victims of love. We are all born out of love and sex. But the sad thing is, we don't talk about it. Patients don't talk about it, doctors don't ask about it. So I really congratulate IDCM Metacon to keep this important aspect of our quality of life and to increase the understanding of how important it is and how to manage. I would be giving you some nuggets of wisdom and some practical tips in managing your patients' sexual dysfunctions, which they all have. They don't talk about it, but they all have. And how you should come out of your clinical inertia and talk about it. With pranams to God and thanks to my teachers, Dr. O.P. Kapoor, Dr. Prakash Kothari and Dr. Sashank Joshi, I beseech them to bless me always. Mitro, look at our Prime Minister. His hands are down because he gave us lockdown and GST, which was really useful for us. So I said, he told me, Deepak, so I said, I'll also give something to the world. Look, my hands are up. So I offer unlock down and GST, and my GST to all of you is great sex therapy. At the beginning of marriage, every wife treats her husband as God, Pati Parameshwar. But somehow later on in marriage, I don't know, the words change. Men after 40, what urges make men chase women they have no intentions of marrying? It's the same urge that makes dogs chase vehicles they have no intentions of driving. Sex is the best prescription of good health. It's not a secret. You need to understand. It's not a secret. Who doesn't know about it? Even kids know about it. It's sacred. And enough studies to prove, even American Urologist Association, American Heart Association, they all say that it benefits every system of our body. And it said use it or lose it. Sexuality is our fundamental right. It doesn't stop at 40, 50, 60, 70. A man or a woman can have sex from 9 years to 90 years. We don't talk about it. We become judgmental. What will my grandchild think about it? What would my friends think? All these things. There is no age for sex and there is no time. You can do it anytime. And friends, trust me, sex really has no expiry date. Rishi Kama Sutra in his book Vatsayana says sex is to be used and not abused. Every male and female today have some or the other issues in the bedroom. 40% of men are not happy, 62% of women are not satisfied. No one in the history today has died while having sex. People who have died post-coitally are those who had sex with illegitimate partners after a heavy drink or alcohol or heavy meals. Jama beautifully said sexual activity triggering myocardial infarction is one less thing to be worried about. Impotence has been the common cause of divorces in India. There are more than 30,000 cases pending. And all unmet sexual desire morph as various psychosomatic illnesses. Intimacy is ageless. Physical intimacy is, trust me, it is ageless. We are all going to live long. There are 5 cities across the world where people are living more than 120 years, and we will be one of them soon. So, but to ignite intimacy, we need proper strategies of mind, body, and sexual pleasure. We need to have realistic expectations. We need to tune our body to it. We need to keep our body sexually fit. Because today, marriages are very late. Women are getting married after 35, 36, so it's late pregnancies, etc. They are not bothered about the financial insecurities. They are all earning more or equal to men. So what is the thing which they want from a man when they get married or when they tie a knot? So of course, sexual pleasure is one of them. So today, this is a new parameter of a strong relationships. Let me give you a new perspective. My large data from KEM, most diabetics had erectile dysfunction, premature ejaculations and low desire, and women had low desire, and depression was seen as the most common symptom in every diabetic woman. There has been enough studies to prove that there is a link between diabetes and sexual dysfunctions. When you look at a male sexual response, according to Masters and Johnson, who are the fathers of sexual health, desire is the foundation of the whole thing. Leads to arousal, which is erection, then ejaculation, orgasm, and resolution. In women, it's the same thing, except there were multiple orgasms and then there's a resolutions. So if we look at male, the desire could be low, could be high. Erections can be normal, can be dysfunctional. Ejaculations can be delayed, absent, or early, and of course painful. So these are all the common dysfunctions which we see. So when we look at male sexual response, there are 4 cardinal questions we ask our patients. Do you have a desire to have sex? When he says yes, so when you go to your partner, touch her, kiss her, hug her, do you get erections? Do you get erections when you get up from sleep? Do you get erections when you see something erotic? And are you able to penetrate well? Are you able to sustain well? Is your partner happy with it? So these are the simple things which we ask. Now let's come to each part of it. Desire. How will you assess desire? It's an instinct that you need to have sex. That's desire. That's a definition. We need to ask about how often do you get sexual thoughts or dreams? How's your coital experiences? Do you also do other activities? Who initiates sex? These questions will tell you all about his desire. And friends, broadly, desire is due to low testosterone. Low desire is to low testosterone. So keep this in mind. And all diabetics are testosterone deficient. They are all hypogonad. That was the desire. Then comes the erection. The commonest problem is erectile dysfunction. You define it as inability to attain and sustain infection for a happy sexual intercourse. This has to be generalized. It is not that he's not able to perform with his wife but perform with his partner. So that's not erectile dysfunction. Or he had sex yesterday and today is not. It's not. It should be at least for minimum 6 months, and there has to be a interpersonal distress. And he should not be having any mental disorder or should not be on any drugs. When you look at erectile dysfunction, you need to know what are the mechanisms of erections. There is first this neurologically mediated arterial inflow into the penile sinusoid. So that's the first thing. The blood has to flow inside. Then there is a relaxation of the smooth muscles, so the blood gets collected there. And there is restriction of the venous outflow, so the penis remains rigid. So if these 3 things are there, your patient's normal. I ask my patients only 3 things. If I really want to know he's normal or not normal, I look at three things. One, whether he has a penis. Second, he has a blood. And third, he has a blood flow. It may be less or more. Today, medical sciences have advanced so much that whatever is less in our body, say if your calcium, vitamin D, B12 is less, you can increase it. Whatever is more, your pressures, your cholesterol, your lipids, we all can bring it down. So whatever is less, we can increase it. Whatever is more, we can decrease it. And there have been various causes of erectile dysfunction, but according to me, if the penile nerves stimulate, if the vessels circulate properly, if the muscles facilitate properly, and the hormones regulate, you're normal. Cigarette smoking. Ask your patient what benefit he has up till now of smoking. Any one benefit, if he tells, challenge him. Tell him there are two things which can happen with smoking. You can either get tuberculosis or you can get cancer. What do you want? He says, oh no, I don't want anything. That's it. Youngsters watch a lot of porn. When they watch porn, they masturbate. And it's the images and the videos which give them erections. That aggression in the sex which is fake, which is edited stuff. So they get erections by watching videos and images. And that's how they are hardwired. When they get married, on the wedding night, that same scene which used to give him erections is not there in his bedroom. So he doesn't get aroused. So the wives complain, doctor, he didn't do anything during the wedding night. He didn't do anything at the honeymoon. He's not a man. I want divorce. So this is what happens. Porn-induced erectile dysfunctions. So when you look at erectile dysfunction, what actually happens is, this is the normal endothelium, produces endothelial nitric oxide synthetase, which is present in a normal endothelium. This enos potentiates the miracle molecule or the molecule of life or the currency of the cell, nitric oxide, to enter into the corpora cavernosa smooth muscle, convert GTP into cyclic GMP. This cyclic GMP hydrolyzes into 5-GMP sadly, but this cGMP is responsible for relaxation and allowing the blood to flow inside. So today what we have is PD5 inhibitors in the form of sildenafil, vardenafil, udenafil, tadalafil, nuclear in the block, avanafil. But to reach that stage, your body should have enough nitric oxide. And to have enough nitric oxide, your body should have a normal endothelium. This is the main thing which we all should take home. You need nitric oxide. We all, after a certain age, become nitric oxide deficient. When we look at diabetes, advanced glycated end products, oxidative stress, ultimately leading to erectile dysfunctions. So in every diabetic, you will find these patients have a mild, moderate or severe erectile dysfunctions. So you are only as old as your endothelium. So our focus has to be on restoring the endothelium, not just giving them PD5 inhibitors. Then there are certain issues with penetrations. Some say I am able to penetrate, but my penis loses its stiffness. It's due to anxiety, distraction, herpes, urethritis, strictures, inadequate penovaginal contact. Then there are issues with ejaculations. They say semen is just dribbling out. No semen dribbles out. Semen always comes out with a force. If that is, he complains of, he said, it stains my undergarments. It's Cowper's gland secretion. So what we tell them that आपके घर में जब भी अच्छा खाना बनता है तो do you get water in your mouth? Yes, doctor. So this is also something like that. It's not a disease. It's a normal secretion of Cowper's glands, which doesn't require any treatment. They are very panicky. They feel that I am losing my semen, vitality, etc. and all that. So this has to be, semen doesn't come out. Yes, it could be a stricture in the vas deferens, blocked somewhere. Semen doesn't come out. Old age, certain drugs. Semen comes out in less quantity, aging, drugs, etc., low testosterone. Semen comes out after a while, delayed, less attraction. These things happen. Premature ejaculation is not a disease. It happens to everyone sometime or the other in your life. It is more common than common cold. It's a psycho-behavioral problem. We have drugs like clonil, clofranil, tramadol, depoxetin, and depoxetin is one of the best drugs which we can give in the dose of 30 milligrams, 60 milligrams once a day without alcohol. Don't tell them that you take alcohol. You can take alcohol. No. According to me, you can give depoxetin for 3 to 4 days continuously, but not more than that. If you give more, they may develop some other issues. When we come to women in our country, they are all tight-lipped. And issues with women are they have low desire, absent lubrications, less or absent orgasms, painful sex, infections, depression is the common. So when we treat, we call the couple together. Couples therapy always help. And when we treat women with drugs, we can give them PD5 inhibitor, flibanserin, a new drug. Botox has also been tried. Estrogen, testosterone works very well. Tibolone works very well. There are a lot of herbal agents, lubricants, repellents which we can give. And bupropion is the best drug which you give for diabetic women with depression. So it's a huge problem with the individual who has an issue, of course the partner, and there is definitely a dealt-in relationship. My best part of my talk is the practical tips for which I have come here. Any male whom you think could be having erectile dysfunction, say he's 30 years old or 25 years old, but has a family history of metabolic syndrome, just get a CBC done. Simple CBC. Look at the platelet and lymphocyte ratio, total platelet, total lymphocyte ratio. If that is more than 105, he's got mild ED. If it is 116, he's got moderate erectile dysfunction. If it's 136 and above, he's got severe erectile dysfunction. Very simple, don't have to talk to him. But when you see his CB and do a mental calculations and then confront with him, he will call you Sai Baba, sir, how did you know about it? I never told you anything. And 4 quadrant of patients, diabetics, hypertensive, obese, dyslipidemic, uncontrolled, likh ke rakho, he's got erectile dysfunctions. Very common thing is buried penis syndrome. They can't even look at their penis. So much of fat is there in front of the pubis. So put them on 1 gram of metformin, sesame seed oil, till oil, and L-arginine gel 10%. Ask him to apply it on the shaft of the penis. In 6 weeks, you could see this. I work for Bombay Police, and a very simple thing I do, I look at the dropping belt sign. Just look at the belt. If it's coming down, he has got erect. Spot diagnosis. Sleep apnea. Enough studies to prove that it causes erectile dysfunctions. Look at the oral hygiene. See, our saliva has got so much of microbiomes which can make nitrates, convert it into nitric oxide. This nitric oxide goes into the nitrite goes into the stomach and gets converted into nitric oxide. So we have dietary resources which can produce nitric oxide in our body. It's not just the endothelium which makes it. You can have foods which can produce nitric oxide. So you need to keep your oral hygiene to be normal. Okay. So periodontal disease and erectile dysfunction. Low vitamin D, how common it is? Very common. Hypovitaminosis is associated with erectile dysfunction in diabetic patients. Raised uric acids, our patients are on diuretics. Simple diuretics can also raise uric acids. So change the drug, put them on nebivolol. If you want to give them diuretics, give them endopamide. We have 4 PD5 inhibitors. The mechanisms of giving which PD5 inhibitor to give to your patient is a challenge. If you have prediction that, okay, in the next 3 to 4 hours you're going to have sex, take sildenafil. if you have no prediction that abhi 1 घंटे के बाद होएगा, 4 घंटे के बाद होएगा, 7 घंटे के, take tadalafil. They have a longer half life. Low dose PD5 inhibitors continuously to be taken for 6 weeks is the best thing for every diabetic, because many studies have shown that it improves the endothelium, it gives him erection, it reduces the symptoms of lower urinary tract symptoms. Very beneficial. So how do we treat? Of course, oral therapies, injections of papaverine, vacuum therapy, intraurethral prostaglandins, and if these fail, we send our patients for implants. But counseling and lifestyle measures have to be followed. Lot of side effects, contraindications are nitrates. So new drug is avanafil, the best drug today, which can be given to your patients who are also on nitrates. Skip the nitrates on the day when he has to take avanafil and have sex. This drug washes out from his body in 5 hours. Onset of action is 15 minutes. He has sex. Next day again you can start his nitrates. 50% patients don't respond to nitrates. They don't respond to PD5 inhibitors. So they are non-responders. Every patient who has erectile dysfunction is melatonin deficient. So put them on melatonin. They'll get very good sleep. Circadian rhythm is also maintained and they get very good erection. Glyceryl trinitrate can be applied on the shaft of the penis and these patients get fantastic erections. Just take the advantage of that drug. Only side effect is headache. Bariatric surgery, insulin pump. We have been treating these patients with so many days, but we don't treat the etiology. Herbs, we have L-arginine, we have fenugreek, beautiful drugs, body compliant, no side effects, because fenugreek has a composition exactly like testosterone. So this increases your desire. L-arginine is a nitric oxide producer. So if you look at the male sexual response, desire is taken care by the fenugreek, which fenugreek tablets are available in the dose of 1 gram today. You just need 500 grams per day, milligrams per day. So testosterone, we can avoid testosterone. So my take home message is, the risk factor of all risk factor is endothelium. So there are a lot of strategies to improve the endothelium. Lots of strategies, a lot of medications are also there. And it's the nitric oxide which is the holy grail of inflammation. Nitric oxide is extremely important even for gaseous exchange in the alveoli. Loss of nitric oxide is associated with atherosclerosis because endothelial nitric oxide synthetase has been known to be anti-thrombotic and anti-atherosclerotic molecule. The discoverer of this got Nobel Prize. I was fortunate to meet Fareed Bhai. Nathan Bryan, who has studied so much on nitric, there are 250,000 papers on nitric oxide. What he says?
It's low blood flow, we call focal ischemia, inflammation, oxidative stress, and immune dysfunction. Nitric oxide corrects all of these. So how do we biohack to improve nitric oxide? The earliest stages of vascular inflammation are when monocytes and neutrophils start sticking to the lining of the blood vessels. This is the action of the spike protein. It activates platelets. The blood vessels become like Velcro. And we were able to visualize this in real time. So this is real-time intravital microscopy of an inflamed blood vessel. You can see the monocytes and neutrophils are stuck. There are a lot of cells that have already migrated through. So this is a heightened state of vascular inflammation from a poor diet. If we give that same atherogenic diet, but we restore nitric oxide production, the blood vessels are more dilated, the monocytes and neutrophils don't.
So nitric oxide, we get 50% from the endothelium and 50% can be had from our diet like beetroot, green leafy vegetables, nuts, pomegranate, watermelon, citrus fruit, seeds, garlic. So you can counsel your patients to take them all these things so they'll get enough nitric oxide even if he's got buggered up endothelium. So we all think we are aging, but as we age, one very important thing we should understand, we should restrict calories. Just take home this restrict your intake of food, whatever food you are eating. Because if you restrict calories, you will activate serotonins, which are anti-aging genes which are present in our body. They are lying, they get activated only when there is no food in the body. So if you activate sirtuins, enough studies to prove that you will live longer. Autophagy, by fasting, you initiate autophagy, which means clearing up of all the cells with clutter and debris. The discoverer of this got a Nobel Prize. Hormesis, stress your body to a certain extent, work out, sexual hormesis. Try and do different things. Don't do the same things in the bedroom. You'll set up monotony and erotic boredom. Your partners will not like you. The commonest cause of dislike or having no sex is monotony. So these three pathways are very important. Testosterone replacement has been beneficial. Coronary artery diseases have been reversed today with just lifestyle interventions. Cleveland Clinic clearly proves that nutritional intervention not only halts but even reverses coronary artery disease. So, my last perspective is love your body. You're unique. Avoid salt, oil, and sugars in excess. Have a regular rhythm of sex life. Increase your romance, increase your touch. Rishi Vatsayana in Kama Sutra says it is to be samabhog, means equal joy. So the onus of sexual health lies with we physicians. We need to have realistic expectations and lifestyle. You may be Hindu, Muslim, Sikh, but make lifestyle as your first religion. This is a diet which you can give, but the last part is most important. Avoid salt, oil, and sugars. Sleep for 7 to 8 hours. Fasting for 12 to 16 hours. And walk for 30 minutes of day. Because if you follow lifestyle, you improve your pro-inflammatory status, oxidative stress, insulin resistance, endothelial. Friends, medicine is not healthcare. Food is healthcare. Medicine is sick care. It's time we realize today. 2 times Nobel Prize winners said that the diseases are all due to nutritional deficiencies. Take home this, learn from these brilliant Nobel Prize, Nobel laureates. So you will fall sick only by 2 reasons. One, what you put in your body and what you do with your body. We have all 4 PD5 inhibitors, they don't increase the desire. 50% don't respond to it. So we give them testosterone, but we can't give it to everyone. We have to give it with caution. We are scared of prostatic issues. So who's the Raja of all? L-arginine, fenugreek, regenerative medicines, lifestyle modification and activating sirtuins, autophagy and hormesis. Very important. You don't require medicines. Medicines is sick care. You require for a normal health span and normal lifespan, good nutrition. There is no law which says you must age. Build muscle. Muscle is anti-inflammatory and fat is inflammatory. So increase the anti-inflammatory thing in your body. Our body has a capacity to stop senescence, stop aging of the cells. You may chronologically increase. Today you are 55, you'll become 57, 58. But make your biological age, the age of your cell, to reverse as much as possible. Love and intimacy don't need any. My last 2 slides. Friends, men have issues, women don't. Woman is a miracle of God. She's a masterpiece of God. She's the best phenomenon in this universe. She's uncomparable. We must adore, admire, trust and respect women. We are all born out of her. We can't ignore her choices, her wishes. We need to take treatment. You counsel all the men to take treatment and get better. Don't deprive your partners of all the pleasures or the rights which she has. If a man who doesn't respect, adore, admire, trust feminism, I pray to God that he should get permanent, incurable erectile dysfunction. So it's nice to know that today for male sexual functions, dysfunctions, erectile dysfunction is a correctile dysfunction. This can be managed today. If you have patients with ED, treat them. Counsel them, at least tell them on what they should eat. Investigate them. Just a simple CBC will tell you. Give them slow dose of PD5 inhibitors. Put them on a short course of testosterone. Give them fenugreek. Give them L-arginine. They will improve. Okay, they may not improve sexually, but their health will improve, their longevity will improve. If you can't do that, send them to a good sexologist. He will see that he gets a good erections. So what is an ideal prescription? Counseling, lifestyle measures to be followed. Metformin, SGLT2 inhibitors, very good. Statins, amongst antihypertensives, give them nebivolol if beta blockers are required, indapamide if diuretic is required. So ask them to be passionate, fearless, and focused even in the bedroom. Elections can be faulty, but erections can never be faulty if you follow this. This is my book, Sex Has No Expiry Date. My last slide. Erectile dysfunction is very prevalent and the earliest marker of coronary artery disease. Diabetes is the sexual health tsunami of our century. 4 PD5 inhibitors are very effective. Low dose PD5 inhibitors, statins are choice. Testosterone short course can be given. L-arginine supplement with fenugreek is a boon. Diabetes remission is a fact and not a myth. Detailed history, counseling, empathy, education are the key. If you do so, erectile dysfunction is a correctile dysfunction. So don't let your diabetics die in bits. If you think really sex has no expiry date, thank you all for your love. I'll be happy to answer any questions. PD5 inhibitors are to be, when we give PD5 inhibitors, you have to counsel for at least 5 minutes. Say if you are giving sildenafil to your patients, look at his weight. If he's around 60, 70 kilos, give him about 100 mg. Don't give him the pediatric dose 25, 50, it won't work. Then ask him to take it an hour and a half prior to dinner if he's planning to have sex after dinner. He should not take it just immediately after dinner or something. He should take at least 2 hours prior to dinner. And after taking the tablet, he should not read Bhagavad Gita or Hanuman Chalisa. He needs to stimulate himself. He needs to think erotic. He should not watch Astha channel, Sanskar channel, pray to God. Nothing will happen. So he needs to stimulate himself. And when he eats his dinner, it has to be a very light dinner, not heavy dinner. Because post heavy dinners, most of the body's blood gets collected on the stomach and intestine to digest the food, which is a must. And in doing so, his private parts are deprived of the optimum blood which he needs to get a desired erections. And if he has not had sex for 6 months to 1 year prior to taking this tablet after 6 months, ask him not to enter into peno-vaginal sex on that day. Day 1, day 2, day 3, he should take the medication, sleep with the partner, do extensive foreplay, whatever he can, as much as he can, but no penetrative sex. Because in these 3 days, he will feel the difference and experience the change in him. And this change will give him confidence which he needs. So this is all you got to tell your patients when you give them medications, which doctors, the chemists don't give. So many patients come as, sir, मैंने लिया 500 रुपये का गोली लिया, कुछ हुआ ही नहीं. How will it happen? If you're taking it 5 minutes before the act, it's not going to happen. If you're taking it after heavy meal, it's not going to happen to you. So this is all we need to tell them. And about tadalafil, 14 years non-stop patients have taken, they have got no side effects. No one has died of PD5 inhibitors unless you have given them if they are already on nitrates. Or if you give them, something combinations like 2, 2, 3, 3 PD5 inhibitors which so many gives, that's the wrong thing to happen.
So you mentioned about weekend L-arginine.
Yes.
Is there any commercially available?
So many, bhara pada hai market.
Can you mention few actually good ones so that we can give it to our patients?
Zydus has got Erect X, which contains L-arginine in the amount of 2.5 grams. Fenugreek 330 milligrams, zinc, pyridoxine and magnesium. These 3 things, it's called Erectex. We have RG1 again having L-arginine to the tune of 5 grams. They are all in sachet forms to be put 1 sachet in a glass of water once a day for at least 3 to 6 months. Because at the age of 50, 60, we'll have only 15 to 20% nitric oxide left in our body. We need nitric oxide to initiate the whole erectogenic mechanisms. Of course, dietary sources are there, plus this is also required. And reversing the metabolic syndrome is very important. If not reversing, control of metabolic syndrome is extremely important. Because the endothelium gets buggered up. Sildenafil in an adult, give them 100 mg. If he says after taking that he got severe headache and bluish, greenish, he could see, reduce the dose to half. Okay, if he is planning to have sex within 3 to 4 hours, if it's not predictable, put him on tadalafil 20 mg, which will last for at least 17.5 to 20 hours. It's called a weekend pill. But people who don't want to have sex every day or don't want to take on schedule because they feel मैं गोली लेगा तो ही होता है, put them on 2.5 or 5 mg of tadalafil for on a long term basis. So after 5 to 6 days, in his, because tadalafil remains in the cell for 80% of its volume, 20% is gone away. So if you give them low dose, he will never get the side effects of an adult dose of 20 mg. Over a period of 5 to 6 days, that much amount of tadalafil is already built up in him. So after 6 to 7 days, he'll start feeling normal. He'll start getting morning erections. He'll get lower urinary tract symptoms, which they will not be there. His prostate will not be enlarged, and he'll get very good erections. And avanafil is available as 100 mg and 20 mg. It's a very special drug. Can be given to patients who are also on nitrates. Ask them to skip nitrates, take avanafil, very less side effects. Onset of action is the fastest. 15 minutes is nothing. So he takes a pill, arouses himself, does foreplay, he gets good erections within 15-20 minutes, has sex. This drug gets washed out from his body in half an hour, in 5 hours. Next day again he can start taking.
Thank you very much.